Welcome to the Cancer Support Suffolk podcast. Join me, Mark Murphy, and my brilliant guests as we talk about life before, during and after cancer. Hello, I'm Mark Murphy, the CEO of Cancer Support Suffolk, and welcome to our brand new podcast supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. Every month we'll be talking to people who've had a cancer diagnosis and they'll be sharing their personal journeys with us. We'll also be talking to health professionals for all the latest news on the treatment of cancer. This month we're looking at lung cancer, and with me is Chris Garlick. Chris is a lung cancer nurse specialist with ESNEFT, that's Ipswich, and Colchester hospitals. Welcome to the podcast, Chris. Great to see you. It is Lung Cancer Awareness Month this month, isn't it? So something that we timely are talking about together.
Yes, indeed. And I mean, it's often a difficult subject to talk about, but I think it's important that as much as possible we try and raise awareness. And lung cancer is one of the more common lung cancers that we see. So I think it's important as much as possible to try and get the message out there and encourage people to recognise what the signs and symptoms might be and what they need to do if they're concerned or notice any change in their general health or particular symptoms.
It's still affecting an awful lot of people every year. I was looking at some statistics earlier on, more than 43,000 people diagnosed with the condition every year in the UK. So it's still a very, very common cancer.
It is very common. It's the third most common cancer. And for a hospital like Ipswich, we see around 250 new lung cancers diagnosed each year. Although we expect the numbers to decrease at some point in the future as people reduce their smoking. We haven't quite seen that yet, but hopefully over the years to come we will see a reduction.
Yeah, we'll talk about smoking in a moment or two, and also the other causes of lung cancer as well, because it's not just smoking, although that is a very important thing. What are the symptoms to look out for? Because, lots of people have coughs.
Sure.
It seems everybody's got a cough these days, post-COVID. So what do we need to look out for? When should we start to be worried?
What you're looking for are a persistent change in symptoms, so usually over the course of 3 weeks. So it would be things like increased cough, increased shortness of breath or wheeze, and often people who do smoke or have smoked may find they have those symptoms, but it's a change in those symptoms or an increase in those over a 3-week period. If they notice a change in their voice, if it becomes hoarse, difficulty in swallowing sometimes, increasing fatigue, so more tired, and weight loss without trying to lose weight, and on some occasions coughing up blood, which can be alarming. So usually they're the main symptoms that one might notice, and I think it's really important to say that those symptoms necessarily don't mean to say you have got cancer. But if you notice any of those symptoms, you should certainly go and see your GP and seek advice.
And 3 weeks is a good guide, isn't it, really, to, if you start to think, what's up here, a week goes by, a couple of weeks go by, third week, then you really need to go and see somebody, don't you, for all sorts of ailments, actually.
Yeah, absolutely. And often friends or family will notice as well. And quite often we see people who come to the hospital because their wife or husband has, in their words, nagged them to go to the GP. And we know that the sooner people go to their GPs and the sooner we can diagnose all cancers, but particularly lung cancer, the greater the options are for treatment.
It's interesting you talk about some of the symptoms being hoarseness of voice, that kind of thing, swallowing. You wouldn't necessarily equate those to lung cancer.
No, you wouldn't. And I think, again, these aren't specific to lung cancer, but they can be symptoms that might indicate that there's a problem. And so it depends where in the lungs the problem is as to what type of symptoms one might get. And I think one of the difficulties with lung cancer is that there are no nerve endings in the lungs themselves. So people often would imagine they get pain if they have a cancer or a lung cancer, and that's not always the case. Many people never get pain. So sometimes an early lung cancer doesn't present with any symptoms at all. And at the moment, we don't have a national screening program like we do for some cancers. The screening program has commenced, and it's in some areas in the country, and it will be being rolled out over the next number of years.
So if it's difficult, if you're not showing any symptoms, there's no pain, is that why so often people, when they have a diagnosis, it's late stage cancer?
Yes, often, particularly with lung cancer, when people are diagnosed, it's usually because they've got symptoms, and often that's a sign that the cancer has indeed spread. And that's why lung cancer is a difficult cancer, because most people present with disease that's late on or demonstrating spread of disease. But again, it's really important for people, as soon as they notice those changes, because I think it's natural. The human condition generally is that we try and ignore, distort or deny difficult things, which is perfectly natural and normal. But I think particularly if you ever were a smoker or are a smoker, it's really important that you report to your GP with those symptoms.
Yeah, early diagnosis. We talk about it all the time here at Cancer Support Suffolk. Yep. Early diagnosis, absolutely crucial. Don't be an ostrich and stick your head in the sand if something doesn't feel right. It might not be anything. If it is, hopefully it's caught early enough, and that makes a huge difference, doesn't it?
It makes a massive difference, and I think the earlier we can catch cancers, the more likely we are to cure them, or the more aggressive we can be with the treatments. And I'm sure we'll talk about the treatments, but there's been a sea change, really, in the way that we can manage lung cancers now.
There are different types of lung cancer. You kind of touched on that a moment or two ago. So tell me a bit more about that.
Well, there are two main types of lung cancer. One's called non-small cell and one's called small cell. They don't actually mean that much. It just represents the cells that we see under the microscope. So they're the two main types of lung cancer. And then there's a type of lung cancer that affects the lining of the lung, which is called mesothelioma, which is attributable to exposure to asbestos. And that's a very particular type of cancer that people in particular occupations will have been exposed to asbestos. So if you've worked in the building trade, if you've worked in public buildings, a lot of public buildings, hospitals included, had a lot of asbestos and still do, or anybody that used asbestos in the sort of 60s and 70s, because it was a very commonly used material. So anyone that was exposed to asbestos is at risk of mesothelioma. And again, it's important to say that just because you've been exposed to it doesn't mean to say you will be diagnosed with it.
Similar symptoms?
Similar symptoms. The difference is that most people present with a sudden onset of shortness of breath, and often that's because there's fluid within the chest cavity that compresses the lung, and then the fluid's drained off, and then we can see an abnormality. But it's a difficult diagnosis because it affects the lining of the lung, and it's not always obvious on scans, and difficult because it's due to occupational exposure very often, and there is a lag time of many decades between exposure and then presenting with symptoms.
So those people who get a lung cancer diagnosis, and you hear people say, oh yes, but I've never smoked. There's passive smoking, of course, so there are other factors, the environment that we live or work in could be a risk for us.
Indeed, yes. I mean, certainly if you smoke and you're exposed to asbestos, that increases your risk. And we know that there are various pollutants, some of which we know about, like radon gas, which is found in certain areas in the country. And then there are other pollutants that perhaps we're not exactly sure why they might be causing cancers, but seem to be. So yes, I think, but obviously smoking is the biggest risk.
7 out of 10 cases, lung cancer, are smokers?
Yes, so it's something of that order. So I think, we hope and we understand that with the reduction of smoking, which we know is happening, will hopefully have an impact on the numbers we're seeing.
You're not seeing that drop yet, though, I suppose?
Not as yet, no. And I think it's going to take probably another decade or so before we see those numbers fall.
When you see those people who are diagnosed with lung cancer who have been smoking, what sort of reaction do they give? Do they say, oh, I wish I'd never started? Or what's the common reaction? Because there's so much education out there. We've all seen the cigarette packets these days with the damaged lungs, and we've all seen pictures of what lungs look like, after a heavy smoke has been had a post-mortem and stuff. So there's a lot of information out there.
There is a lot of information, and I think the difficulty that there isn't a common reaction,
Right.
if I'm honest. I think, inevitably shock
Yes.
and fear, and often the fear drives the delay in diagnosis. And it's a natural coping mechanism, in a sense, is to ignore the reality. And I think many people who smoke find it incredibly difficult to stop smoking. And, it's highly addictive, which we now know and understand. And when many people in their 70s and 80s started smoking, it was actually encouraged.
Yeah, all sorts of different people were encouraging to menthol cigarettes to clear your tubes and all that kind of stuff. It's amazing how attitudes and knowledge has changed in a generation.
I think we have to have sympathy for people that started smoking where it was encouraged. And we know that the things that have made the biggest difference to people not starting smoking or stopping smoking has been banning advertising and increasing the price of cigarettes has made a big difference, and banning smoking in public places. All of those things have made smoking more difficult and have helped to encourage people to stop. And there's a big drive for smoking cessation where people can now have support via their GPs to help stop smoking with patches and medications that can assist with that. But it's an incredibly difficult drug to stop.
I've heard people say, oh, there's no point me giving up now. I've been smoking for 20 years. What's the point of me giving up now? Well, there is a point to giving up because it does help your overall health and reduces your cancer risks, doesn't it? Even if you've been a smoker for a long time.
Yeah, absolutely. It reduces the risk of further cancers. And most importantly, it helps you through or manage the side effects of treatment. So people that have surgery now, we know that if you can stop smoking, it reduces those acute risks of being very ill because of the anaesthetic shortly after surgery. But also if you're going to embark on many of the treatments like chemotherapy or radiotherapy, it will also help you manage those side effects. And then without doubt, there are all the normal benefits, if you like, from not smoking, that you'll feel better, your taste will return, and you'll save money.
Well, yeah, you certainly will in this day and age, that's for sure. Treatments. Tell me a little bit more about treatments, because we on this podcast, we've talked to a lot of specialists, a lot of people who are living with cancer, who've been cured from cancer. Treatments are changing all the time, aren't they? Advances are being made all the time.
Absolutely. I think, there's been great strides taken in the curative treatments for lung cancer. Now, it's true to say that we're only looking at about 14 to 15% of people that can embark on curative treatments. Now, usually that's surgery, but the surgery has changed. We're able to do more aggressive surgery now, and that can be done robotically, or the traditional chest surgery where the chest is opened and a portion or a lung can be removed. But we can also remove more advanced disease now than we could some years ago. So surgery is certainly advanced, and radiotherapy can also be used with curative intent. So radiotherapy is using high-intensity X-ray beams where you shine those at the target, in this case a lung cancer, to cure the cancer. So we know that we can cure, around 14-15% of people with lung cancer. And then people who have disease that we're unable to cure, we're looking at treatments to try and slow down the progression of disease. Now, historically, we've used radiotherapy, which, as discussed, is targeted treatment, and chemotherapy is the drug treatment for the treatment of cancers and is used in lung cancer. And it can work relatively effectively in slowing down the rate of progression with the aim of trying to put the brakes on. Now, unfortunately, what we know is that at some point the cancer will regrow after chemotherapy, and there are second-line chemotherapies we can use. So traditionally, that's what we had up our sleeve, if you like, to treat lung cancers. However, over the last 5 or 10 years, we're now able to look at more targeted treatment And it means that when someone's diagnosed with a lung cancer, we're able to get some tissue to make the diagnosis to confirm what type of cancer it is. And we can look now more closely at the cells and identify genetic changes in the cells, which help us to understand which patients might respond better to chemotherapy, which patients may respond better to immunotherapy. And immunotherapy has been a game changer for lots of cancers, and particularly for people with lung cancer, where we know that if we can give immunotherapy, some people who previously had disease that they would unfortunately die from within a matter of months can now live for a number of years. And it's generally less toxic, so it has fewer side effects. And so it's a better treatment option, and it gives better benefits.
So it's much more targeted now. I mean, it probably was never one size fits all, but it might well have been close to that.
Absolutely.
But now much more targeted. So you could have a group of people here with lung cancer, and their treatments would be potentially very different.
Very different. And we also know that we've got more lines of treatment, which again is encouraging. So people now are living much longer and are able to have, more treatment options. And we also know that for never smokers, we know there tends to be some genetic changes that we find which allow us to use a tablet-based treatment, which has allowed some people with quite advanced disease to live for many, many years with advanced disease. And again, it's less toxic, and people do really well on that tablet treatment. So it's encouraging, and I think that the changes in lung cancer, and all cancers, if we're honest, tend to be incremental. Often people will be looking for something that's going to make a big difference in a short period of time, and we have to be honest and say that changes in treatment tend to happen in a stepwise manner, but we're certainly seeing that with lung cancer. And there are newer treatments on the horizon, which we hope will make us, a further difference, like vaccines, I think.
The best thing, of course, is never to start smoking in the first place, isn't it?
Yes, absolutely. And I think it's an important message for anyone with young children to get that message across. We know that it used to be a cancer that affected more males than females, and we know it's now about 50-50. But we also know that more younger females are starting smoking than younger males. So I think as much as possible, the most important message from today is to look at prevention.
Yeah.
And if we can stop people smoking, then we know we'll reduce the amount of lung cancer significantly.
It's so difficult when you're young, isn't it? Because you think you're invincible, old age, potentially lung cancer is, decades away. It doesn't even occur to them probably. I don't know how you get the message through. I really don't. I mean, people have tried for so long.
Yeah, and I think it's incredibly difficult because, of course, if it was simple, then we would have done it.
We would have done it by now, yeah.
But I think it's just to keep hammering home the message. And because, as you say, it's, if you're talking to somebody in their teens, then fortunately or unfortunately, things like cancer tend to happen decades down the line. But I think that it's really important that we try and press home the message. I think that's as much as we can do is to be as honest with people as possible.
Where do vapes come into this? Because a lot of people have moved from cigarette smoking to vapes, haven't they?
Yeah.
But what we're also seeing is people who have never smoked, younger people particularly, starting to vape.
Yeah.
Which was never the idea, really, was it?
No, I mean, it's a real problem. And as you say, vapes were really brought in to try and help people stop smoking, and they did that very well. But what we also now know, unfortunately, is that a lot of the advertising that can't happen and promotion of tobacco seems to have been transferred over to vapes. And I think all we can hope for is some legislation, and health promotion is the best tool we have in our box. And I think it's talking to friends and family about the fact that, okay, at the moment we don't know what the true impact of vapes is going to be.
It's still so new, isn't it?
Yeah, and I suspect it's going to be some decades before we know. But logic would dictate that inhaling substances into your lungs is not a good thing.
No. Well, we see that very graphically with some smokers' lungs, don't we? We really do.
Yeah.
And it'll be interesting to see what happens in the future. The work that you and your colleagues do at ESNEFT, Ipswich and Colchester, replicated around the country these days. And really good to know that you're there helping people with that diagnosis, because when we've talked about the amazing treatments now, but when they still get that diagnosis, it's a heck of a shock, isn't it?
It is, and I think we have to recognise that it's scary being diagnosed with lung cancer, because inevitably any cancer diagnosis tends to lead people down the path of facing things that we'd all rather ignore. And what inevitably people think about is loss and death and dying. And they're incredibly painful and distressing things to think of. And no doubt going through treatment forces one to face those issues and to deal with what can be difficult symptoms from treatment. And there's no doubt that obviously cancers, and any cancer, is a physical assault, but it's an emotional, psychological and spiritual one too.
Yeah, it's what we find here at Cancer Support Suffolk. That's why we're here, to support people with that diagnosis and their families as well. Well, Chris, thank you very much for joining us on this month's podcast. It's been really interesting to hear your take on things. And, the takeaway from this podcast is let's try and cut down the number of people smoking. If you've got young people in the family, talk to them about the dangers and the perils of it. Don't get them started in the first place. And then hopefully in the future, there'll be fewer and fewer instances of it. Chris, thank you very much for joining us on this month's podcast. That's Chris Garlick joining us this month on the Cancer Support Suffolk podcast. He's lung cancer nurse specialist with ESNEFT, which is the Ipswich and Colchester hospitals. Well, that's it for this month. Thank you very much for listening to this episode. If you'd like more information about what we do, please head to our website, cancersupportsuffolk.co.uk, or you can call us on 01473 211 884. We're based in Ipswich here in Suffolk. Cancer Support Suffolk is passionate about educating and supporting the people of Suffolk, and as a registered charity we rely on donations and fundraising to be able to continue our vital work in the community. This podcast is the copyright of Cancer Support Suffolk and is produced and managed by podtalk.co.uk, supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. Until next month, from all of us at Cancer Support Suffolk, goodbye.